Hi, I'm talking today to Kate Rothwell. Kate is an art therapist. Hi, Kate, how are you?
Hello, Joanne. I'm very well, thank you.
Wonderful. Kate, let's talk today about mental health and art therapy. How can art therapists help people with mental health conditions? And what sort of mental health conditions can you help people with?
Well, this is a very important one because a lot of art therapists work with people with diagnosed and non-diagnosed mental health conditions, largely in hospitals, in settings where people have been hospitalized because they're so unwell, and also because they may well be on medication that is being used alongside the art therapy, but it's not enough. So in this country, we have the National Institute of Clinical Excellence, the NICE guidelines, and the guidelines on for people working with and who are experiencing psychosis and schizophrenic type illnesses. It does say in there to consider art psychotherapies, which includes art, drama, movement and music. And this is very important because this has been developed out of the research that has been done on arts therapists to show that actually they have very good effects, outcomes for people suffering from negative symptoms. So that's one aspect of mental health. But we also work with people who are also suffering from the sort of more neurotic end of the scale, where they are experiencing that's what I'm saying, to differentiate it from psychotic experiences. But people who have affective disorders like depression, obsessive compulsive anxiety disorders, where they actually function very well on a daily basis, but they do need extra support. Whereas people who have been hospitalized really aren't very well and need more intensive therapy and treatment.
If you're working with somebody who is suffering, let's say, from anxiety, what would your approach be? What would you try and do in the art therapy sessions?
It's probably very similar from anything else, but I suppose I'm also thinking about timescales, because in the NICE Institute guidelines, it actually recommends that we work with people from between 10 to 12 weeks. So we can work that's very short term, right up to much longer. And we have people that might have to work, say, 3 or 4 years, perhaps, and anything in between. So if we're working with somebody perhaps with an anxiety disorder, it may actually be more short-term work, and it might be that we are working in a very boundaried way. So again, they feel safe, but we are still offering them art materials and perhaps suggesting that they think about what their experience is. And rather than traumatizing them, by saying, perhaps work with the worst fear you have, is actually just very, very gently enable them to work in a way that they feel safe with and express perhaps what their fears are. But we may not promote that straight away and put them straight in touch with that. It may be a very gradual thing. And perhaps it's about putting things in perspective and understanding actually what are their fears, what is it that they are anxious about, and how realistic is that? Because for some people who are depressed and anxious, there is a reality to it, but perhaps we need to help them with affect and anxiety moderation, so that they develop the tools and the resources they need to be able to cope. And it is all about developing internal resources, but by expressing it through art making.
What would happen in the initial consultation? Would you spend time talking to the person, or would you straight away sit them down and ask them to draw a picture?
Well, for me, I tend to experience what it's like being in the room with that person. And if that person is showing me by their behaviour, what they're saying, that they are experiencing very high levels of anxiety, then I would say the most important thing is to talk to them and to be calming and containing and reassuring and gently introduce them to the art materials. But if there's somebody that really does need to come in and express something through the materials, then I would say, go for it. Do what you need to do.
Why has art therapy been such a successful form of treatment in helping mental health disorders?
I think everybody would say something very different in terms of how they experience it, but the people that I work with have said to me that they have benefited so much from it because they come in, they feel safe, they feel relaxed, and they find a way of expressing something that is outside of themselves. It is put out there in the materials. They can see it. It is then a concrete thing. It's not like words which will just move away. There is something happening, like building up a body of work. And it's something that they can look back over in time and think, yes, I remember when I was that ill. And you can actually then see and progress how they've progressed right through to the end and say, well, look, this is where you've come. Some people would say that the art making is the most therapeutic thing. Some people would say actually it's being with the therapist and looking at something together, and that is, and then anything else in between that. So the main thing would be to speak to the person that's done the art therapy, see how they understand it. But what I would say is that when they see the first and the last images, they actually can, there's a physicality to it, they can see how they have progressed.
Thank you, Kate. Thank you so much.
You're very welcome.